going to go through what a neuro exam, a comprehensive neuro exam should be for one of our neurosurgical patients. I want to point out that this is not the brief neuro exam that you would do for a stroke patient, but this is specifically for our neurosurgical patients in an ICU setting. You can modify this as appropriate for a spine patient. So I like to take a top-down approach. There's not a right or wrong way to approach your neuro exam. What I would encourage you to do is remain consistent. So if you take a bottom-up approach, you need to do that every single time. Don't do a little up here with the cranial nerves and come down here and do a little bit with the motors. You need to be consistent every single time, which will help you to make sure that you don't miss anything. So first thing I do is I'm going to approach Miss Chris here and say, can you please tell me your name?
Chris Wilson,
Tell me where you are,
Pickerington Methodist Hospital,
and then what year is it?
2025.
Perfect. So she answered those questions clearly correctly. If she did not, I could give her options and prompt her that way. If she is not able to, then I would just say unable to state year with options or examples. So she did that. The next thing that I'm going to do is have her follow my finger. This is extramuscular movement. There are six directions, 3 cranial nerves that innervate that. So just have you follow my finger, just from side to side here. And then I'll have you just look straight ahead. Try not to use the phone light. If you don't have a pen light, the light on your phone, sometimes I've done it. Try not to do that just because it's not medical grade. You really do want a pen light. So I'm going to shine a bright light in your eyes here, one side and the next side. And you might have heard it called PERLA. Pupils are equal reactive to light and accommodation. We're not testing accommodation, but I'm wanting to make sure that her pupils are round and they equally constrict. And I don't have one pupil that is fixed, meaning it will not constrict or dilate, or I have one it's called anascaria, where they're unequal size. And so her pupils are nice, they're round, they're equal, and they are reactive. I'll have you smile. Good. Show me your teeth. Oh, you are. Show me your teeth. Show me your tongue. Stick your tongue straight out, and then go Good. So I'm wanting to make sure that she's got a symmetrical smile, and there's no droop there. There's no ptosis or like a nasolabial type fold drip. And then I'm wanting to make sure that her tongue is straight on, so it's midline. Some people have them moving side to side, that's fine. And then I'm wanting to make sure that her soft palate and her uvula equally rise. Again, this is all testing cranial nerves. Can you feel this here?
Yes.
Okay, those are the 3 branches of the trigeminal nerve. And then we can take this a step further. I do not expect this, but one would be to have her cover her eye and then tell me how many fingers she's holding. All right, and then can you shrug your shoulders up? Good. You can push down. Shrug them up here. Down, okay, it's cranial nerve 11, accessory nerves. All right, so we've done her, all of her cranial nerves. We're now going to move down to her upper motors and then followed by her lower motors. We're going to do the deltoid, here, so the deltoid, her bicep, her tricep, grasp, and intrinsics, okay? So I like it to show me some chicken wings. Most people understand what that means. Don't let me push down. Good. So she is what we would call 5 out of 5. You can rest your arms, meaning she can freely move, she can overcome gravity, and she can overcome full resistance. I will not put all of this in the video. You can look it up online. There's a 0 to 5 grading scale for muscles, but she's a 5 out of 5 there. And I'm also looking for symmetry, so making sure that the right and the left side are the same. All right, so squeeze my hand here, arm wrestle me, pull me to you, good. So I'm checking her bicep, pushing away, that's her tricep. And I would do the same on the other side. Pull me to you, push me away, good. And then another way to do it for a patient is like pull me in bed, push me out of bed. So you want to think about what will help them to understand that. Can you squeeze my hands real hard, good. And spread your fingers out, don't let me bend, good, good, good. So she's a 5 out of 5 for both her deltoid, her bicep, her tricep, her grasp, and her intrinsics. So I would say that she's intact on her upper extremities. Now we're going to move to her lower extremities here. So we think of hip flexion, so the hip flexion here, knee flexion and extension, and then you have dorsiflexion and plantar flexion, which is the ability to flex that ankle there, okay? So lift your knee up, good. Kick me away, good. Bend your knee back, good. Toes up, and then push down, okay? Obviously, you're not going to have a patient with shoes in the bag. If for some reason you do, take your shoes off, make sure that you're examining them without that. If a patient has a foot drop your foot here, they're not going to be able to flex their foot back. Flex your foot back. Good. So they're not going to be able to do that movement there. So So a foot drop would be an alarming sign. The one thing that I will point out is, let's say you have a patient that is not intact, you want to know if that is new, so you always want to go back and look at the previous neuro exam. So that as far as we're concerned, this is intact with your motors, and then I would just ask, can you feel me touching the here, here, and here, so we want to make sure the sensation is intact. It took me a little bit longer because of explaining things to you. You can get this neuro exam done in about 1 to 2 minutes on average, but I would say that she is a neurologically intact patient, and that's how you would do a comprehensive neuro exam on one of our neurosurgical